Hypertension. It's an cardiovascular disease. Look at these pictures. No hypertension, heart pumping normally. Hypertension, heart pumping harder, and echocardiogram findings. Detail going on. Introduction. Hypertension, commonly known as high blood pressure, is a chronic medical condition in which the blood pressure in the arteries is persistently elevated. It is a significant risk factor for cardiovascular diseases, including heart attack, stroke, and heart failure. Hypertension is often called the silent killer because it may not cause noticeable symptoms for many years until a severe medical event occurs. Definition. Hypertension is defined as a condition in which the blood pressure readings are constantly 140/90 mmHg or higher. Blood pressure is the force exerted by the blood against the walls of the arteries. According to American Heart Association, hypertension is diagnosed when blood pressure readings are constantly systolic more than 130 mmHg, diastolic more than 80 mmHg. Types: primary or essential hypertension. No identifiable cause develops over many years. 3. Secondary hypertension, caused by an underlying condition such as kidney disease, adrenal gland tumors, or certain medications. Causes. 1. Genetic factors, family history of hypertension. 2. Lifestyle factors, high salt intake, obesity, physical activity, excessive alcohol consumption, smoking. 3. Medical conditions, chronic kidney diseases, diabetes, sleep apnea, hormonal disorders. Risk factors. 1. Age. Risk increases with age. 2. Family history. A family history of hypertension. 3. Obesity. Higher body weight is associated with high blood pressure. 4. Physical inactivity, lack of regular physical activity. 5. Tobacco use, smoking or chewing tobacco. 6. Diet, high salt intake, low potassium, calcium and magnesium intake. 7. Alcohol, excessive alcohol consumption. 8. Stress, chronic stress can contribute to hypertension. Complications. 1. Cardiovascular disease, increased risk of heart attack, stroke and heart failure. 2. Kidney damage can lead to chronic kidney disease or kidney failure. 3. Eye damage, hypertensive retinopathy which can lead to blindness. 3. Aneurysm, increased pressure can weaken blood vessels leading to aneurysm. 4. Metabolic syndrome, increased risk of diabetes, heart disease and stroke. Pathophysiology. Hypertension results from a complex interaction of genetic, environmental, lifestyle factors that lead to increased peripheral resistance or increased cardiac output. Mechanisms include first mechanism, symptomatic nervous system activation, increases heart rate and vasoconstriction. Second, renin, angiotensin, aldosterone system, regulates blood volume and systemic vascular resistance. 3. Vascular remodeling, structural changes in blood vessel walls increase resistance. 4. Endothelial dysfunctions, impaired ability of blood vessels to dilate. Signs and symptoms. 1. Often asymptomatic in early stages. 2. When symptoms occur, they may include headache, particularly in the morning, dizziness, shortness of breath, nosebleeds, flushing. Diagnosis. 1. Blood pressure measurement, multiple readings over time. 2. Medical history and physical examination assess risk factors and complications. 3. Laboratory test, check for underlying conditions, example blood test, urine analysis. 3. Imaging, endocardiogram, ultrasound or other imaging studies to assess organ damage. Nursing diagnosis. 1. Risk for decreased cardiac output related to increased vascular resistance. 2. Ineffective peripheral tissue perfusion related to increased blood pressure. 3. Anxiety related to diagnosis and potential complications. 4. Knowledge deficit regarding disease, process and management. Disease management, lifestyle modifications including healthy diet, regular physical activity, weight loss, limiting alcohol intake, smoking cessation. Medications, diuretics, ACE inhibitors, angiotensin II receptor blockers, calcium channel blockers, beta blockers, and alpha blockers. One initial treatment, lifestyle modifications and medication based on individual risk factors, to ongoing monitoring, regular blood pressure checks and follow-up with healthcare providers. 3. Management of comorbid conditions, treat underlying conditions contributing to hypertension. Psychosocial medicine, stress management, techniques such as mindfulness, meditation, and counseling. 2. Support system, involvements in support groups or therapy. 3. Patient education, importance of adherence to treatment, lifestyle changes, and regular monitoring. Prevention. 1. Healthy lifestyle, balanced diet, regular exercise, maintaining a healthy weight. 2. Regular screening, routine blood pressure checks, especially for individuals with risk factors. 3. Education, public awareness campaigns on the importance of blood pressure control. In conclusion, hypertension is a prevalent condition with significant health implications. Early detection, lifestyle modifications, and appropriate medical management are crucial to prevent complications and improve quality of life. Thank you. Have a wonderful day.